Recording in progress.
Hello, everyone. Welcome to tonight's Metro DC EDS and HSD support group. And tonight, the group, as well as EDS Wellness, want to present EDS and MCAS, Acupuncture, and Alternative and Complementary Therapies with Dr. Rao from the Shakthi Health and Wellness Center. And Kendra Nielsen-Miles, the founder and director of EDS Wellness, will be moderating for us tonight. So I want to turn the floor over to them for what I think will be an extremely interesting discussion. Thank you.
Well, thank you everybody for joining us. And this is a casual, not necessarily a formal presentation. Dr. Rao does not have slides. So we're going to I'm going to lead her in some questions like we've done before. But please, if you have certain questions, you're welcome to put them in the chat or to put them, I believe there's still a Q&A button, or you can send them to Danielle. Or at the end, if you would like and you're comfortable, you're welcome to ask with your video on and off, or audio on and video on, if you are comfortable with that. Just remember that this is being recorded to hopefully share with other people. So if you would like to keep things anonymous, which we totally respect, then obviously we can moderate your questions for you. So let's see if there's any other housekeeping. I was gonna say, I am Kendra Nielsen-Miles. I am the executive director and founder of EDS Wellness. I've been around for a long time. However, my work has kind of shifted over the last couple of years because of my own health and moving. But I've worked with Dr. Rao for several years. We first met each other when I was doing Wellapalooza, which was an integrative wellness conference and retreat for people with EDS. And we brought in different doctors, some of the very well-known doctors, some other ones like Dr. Rao, who was newer at the time. This was back in, I don't know, Dr. Rao, 2016 or something like that, that we did. One of the days was in Colombia. So some of you may have familiar with what I've done or familiar with Dr. Rao, but she has been nothing but supportive to our community, supportive to me, to the work we do, to patients, but she's a wealth of information. She can tell you a little bit more about her background, but she is a traditional medical doctor that changed paths. So Dr. Rao, would you like to just give a little background on your journey to going from a traditional medical practice into what you do now, and then we can shift to the questions related to EDS.
So I've been in, I'm internal, can you guys hear me okay? Sometimes this speaker doesn't, okay. I'm internal medicine doctor. I've been trained formally in internal medicine about 25 years ago. I've been in practice. And I started doing acupuncture mostly because I was very frustrated with the lack of tools that we have as an internist, which was really medications and referrals and consults and, very few things to actually heal people. And so about 23 years ago, I did acupuncture and I brought it into my practice, which opened up a world of healing versus band-aiding to me. So the next decade or so, I kind of was interested in trying to find things that kind of healed the gut, help the nervous system, the autonomic nervous system, seeing the connections. This was way before the microbiome was a thing. And so we now know that the gut and the microbiome is integral to so many things, including pain and connective tissue issues and GI and POTS and so many things that unfortunately the EDS community has, layers and layers of things that can happen. But I was in a traditional practice for, 15 years. And then I left and opened up Shakthi Health and Wellness Center about 9 years ago, which allowed me to spend more time with people and kind of have the ability to do the things like the integrative therapies that I use and not have to worry about, who's watching over my shoulder, what the billing is it covered, is it not covered? Sometimes it just becomes too overwhelming to kind of think like that. So I now work in a model where it removes the restrictions of the billing issues. So I have a lot of things that we've added over the years. I have come in contact with Kendra over the years because my practice was kind of just this place where I just started seeing more patients with EDS, mostly because I think they didn't know where to go. People didn't have time. I started to then become more of a quarterback, kind of quarterbacking and leading the ship on the multiple referrals and the multiple people they were seeing, multiple medications and the classes of medications. And so I actually learned from Kendra, the workshops I've gone to, the patients I've seen, a lot more about EDS than I have ever known. So in the last 5-6 years, I do not claim to be an expert in any sense of the imagination. But as a result of talking with Dr. Afrin and meeting Claire Francomano and all the people that Kendra has introduced me to, I'm also on the mast cell community. You know, we share experiences, we share our patients' experiences, and we learn from them. And so part of my journey has been through trying to be advocates for patients, also to try to get them the resources they need. And as you guys all know, that there's multiple kind of ways things show up, but the commonality that I've seen is I still come back to the gut. I still come back to the parasympathetic system. I still come back to nutrients and hormones and the basic stuff that I use across the board with all my patients, to look at what's intrinsically and biochemically off and what's nutritionally not sound, so that the connective tissue can do better. As most of you know, it's not going to be fixed in one pill. So I have learned a lot about the role for mast cell with it, the role for the overlap with fibromyalgia, the chronic fatigue, the POTS. And so I've kind of developed a connection between different specialists in the area that do specialize in those. And as a result, my knowledge has been increasing. So I trying to facilitate more of a general wellness for patients with EDS, using the same tools that I use for most of my patients, but also tailor it to the mast cells or the POTS or something else that's kind of, you know, a layered on top of it.
I think one of the things that you mentioned, I'm glad that you shared your journey, and you fast forward it too, because I think it's also important because for everybody to know that Dr. Rao does not have an EDS clinic. She doesn't say that she's a great EDS specialist or mast cell specialist, but I think in many ways that's actually one of the best assets that she brings to the table. As she mentioned, she's a great quarterback. At the end of the day, if we see a geneticist, if we still see an EDS specialist, we all still need a main quarterback, you know, internal medical doctor that can kind of help us with all the things, right? We still have to go get our mammogram for a female. We still have to go get our colonoscopy. We still have to do these different things in the traditional blood work, as well as manage all this other side of being faced and living with these conditions every day. And to have somebody that helps that part, as well as understands all the factors that goes into it, I think is what Dr. Rao really brings to the table. And with that, she's learned so much. I think she discounts how much she's really learned and how much she's really helped so many patients that I know. But she also, you know, you will say if you don't know something or if you're not sure, you will be honest and say it. But you have such a connection to the other specialists in the community and always telling me all these different things that you're researching. Would you tell us a little bit more about how and why, when you started learning about our community and working with our patients, that really piqued your interest?
Well, I think it's because they didn't present in the same way. I had some people present with chronic fatigue. I had some people present with POTS. I had some people present with chronic pain. I had other people with mast cell, which I didn't even know what mast cell was at the time. And it was just an enigma. And I felt like they were all, you know, lost to the system because every specialist was looking at like one thing. And so that one thing was pulmonary, the sinuses, the cardiac, the blood pressure. It was like very, very fixed. And so when we started looking broadly, when I started looking at the gut and we started doing treatments like acupuncture, we started doing things that were along with like alpha stim, the mind body connection. I now have photomodulation or light therapy for pain. When you start dealing with the things that are aggravating the nervous system, you were seeing responses, which was very exciting to me because I had people who couldn't go back to school, who couldn't, you know, get a job. They couldn't stand up straight. They were working again. They were finishing college. They were getting their jobs and they were moving on. They were being able to take care of their family. I mean, not everybody has the same story. And there's plenty of patients I see that actually are on disability and things like that as well. But the point is that their functionality started changing, and it was an immediate, within a few weeks to months of working together. And I was very excited about the possibility of giving people back their lives. I mean, as you guys know, everybody has their own story and journey, but the tools that are offered sometimes are so simple, in the sense of like the right diet is never the same for everyone. Like there's no perfect diet that works for everyone across the board. And to work with someone to help you find that diet, whether it's an antihistamine diet or a SIBO diet or a FODMAP diet or a vegan diet, whatever it is, it has to be a journey. It has to be something that I found was very intriguing because everybody was different. Every single person had a different path. And, as a scientist, as a researcher, as as a medicine doctor, this is very intriguing that not all blood pressure is the same, not all fibromyalgia is the same. And then when I found out about mast cells, that just kind of blew me away because that started to fill in the gaps of a lot of things that I was missing.
Such a Pandora's box. And I will say, as we've walked this journey together, both professionally and personally, I mean, I've also seen you in office in the middle of, dealing with a crisis with a patient that you have never, you haven't had to, we don't know what's going on. And I've seen you walk the journey with us, but then also not leave us, I should say, or say you're too much to deal with. And that says a lot for our community. I think even just alone, like you said, in a couple of weeks, you can see that somebody feels better, but just for us, and you are one of the doctors, but there's several, but just for somebody to have, for us to have somebody that isn't going to leave us, that is going to walk the journey with us and say, you know what, I don't know what the answer is, but I will help you find it. I'm not going to, I believe you, I hear you, I will help figure it out. I'll do my own research. We'll do it together. Just that alone is so calming to our nervous system. So I thank you for that. I think I've said that many times, but just that alone is just to walk into a place that you can sense and you feel that you're believed and that the person may not have all the answers or the magic bullet, or maybe not be the perfect right doctor for you, but at least you are somebody that is on a care team or that can be an assist and believe that patient, which is so great.
Yeah, I often tell patients that, I don't know if you're going to get better with me. I don't know the journey that we're going to have, but I will promise you that I'll try, and I'll try to get the answers with the people that I know, and we can put it out there. The mast cell community has been very helpful with Dr. Dempsey and Dr. Afrin. There's 300 doctors on the mast cell community chat group or group that we're on, and that's been very eye-opening because everybody kind of tells a story of someone, and it can get very complicated with secondary infections and co-infections and Lyme and Babesia and mold and all sorts of layers of things that are activating the mast cells, which can also activate the pain and POTS and all of these things. It's like COVID and COVID vaccines. I've seen so much POTS lately, which is crazy, and we don't really know what that's about with whether it's COVID or post-COVID or the vaccine, but that's been another layer, just like all of these other infections that can exacerbate it. So I feel I think I'm just passionate about trying to help a community that feels kind of underserved, and just not heard enough. And I don't have all the answers, but I think that it's nice to have a relationship with someone that you can at least vent to, that says, I don't know what to do, and have somebody be able to at least guide you in some way, in some category. So I'm also intrigued about getting my patients that I have on this group, because I think communities are wonderful. And I think that as physicians, we tend to get scared of things we don't know. And so, but again, when I started my practice, I don't have the time constraint that I used to have, which is very helpful. So we can allocate, 30 minutes for a follow-up, 1 hour for a new patient, which was never heard of in my old practice where we're seeing 25, 30 people in a day.
Well, and right. And I will say also, there's a couple of things I want to say is to make sure that people understand you also are not all or nothing in terms of medicine or supplements. I mean, you are a functional medical doctor, traditionally trained medical doctor, now termed this way, and you do offer acupuncture. And even though you have these complementary integrative therapies that we'll go into a little bit more and how they could possibly benefit or not, and talk more about like what you've seen recently, because I think there's some really interesting stuff that you and I have talked about that I don't know if anybody else has heard about, and then people could ask questions, but you are not anti-med medication. And you are not, I think that's very important, because sometimes people are afraid that if they go to an integrative doctor or a functional medical doctor, they feel that they're going to be anti-medication or take them off the medications that isn't working. And you do not do that. That's not my experience, but that's also not how you practice. It's definitely.
I don't think I'm anti anything. We used to have in my practice energy medicine and Reiki. I've tried to be as open-minded as possible. COVID shut that down, but those were also very helpful for patients.
Oh, Joyce was great. I mean, she saw my son.
She's still
Right.
amazing. And she works on her own, so we can definitely share her resource with everyone. Acupuncture, like I said, has been very helpful, mostly because it also interacts with the vagus nerve, which then talks to your immune system, which then can help with the parasympathetic and all of these. Everything is layered, and you just want to be able to do inputs that can go across the board. So like a medicine does one thing in one direction sometimes, even a supplement, it's not herbal, can do like one thing or work on one pathway. These interventions that are hands-on, like Reiki and acupuncture and alpha stim and meditation and yoga and the sauna, the phytomodulation, they do more than one thing. So that's why I like to kind of also layer the treatments, medicines, supplements, lifestyle, diet, all of these other interventions. And unfortunately, it does take a village, and it does take more than one therapy. Like rarely does it come in a box or a pill case or a supplement that you're going to get help from in isolation. So you need kind of a combination approach, and that's the challenge, because where do you go? What do you do? There's all these meds, all these supplements, and all these appointments, and people just don't have endless time.
Right.
And the hard part for me is that what worked for you, Kendra, may not work for someone else. So part of the journey is trying things and kind of experimenting and talking about theories that make sense. You have dizziness, lightheadedness, facial flushing, you have headaches, you get a runny nose after eating something. Well, likely you have mast cell, but not every patient with EDS has mast cell, right? So it's not a mast cell trigger. So the point is like trying to target the treatments also with supplements and medicines that are targeted to that particular set of symptoms. And as everyone knows, there can be multiple layers of symptoms, right? So whether it's like a structural issue coming from the neck versus something that's happening because you're exposed to mold in your house. I mean, that's the detective part. And that's what makes it so hard.
So if somebody's like, okay, Dr. Rao, I'm so overwhelmed, I would like to come to see you, or just in general, they're interested in acupuncture. This is the one step I can take on right now. What would be the benefits, and talk to us a little bit more about acupuncture in general, but then also how you've seen it possibly help and work for patients in our community?
Sure. So everything from, the insomnia, the hyper symptoms, the agitation, the anxiety, starting from the head and neck, neck pain, localized neck pain, gut issues, hormone issues, it's endless. Like the fact that somebody can't detoxify properly, all of this can be addressed through acupuncture. So that's what I love acupuncture for, because it is like a core treatment that I don't think anybody would not benefit from. Now, what can happen is if you use too many needles and sit with it very long, you can get low blood pressure. You can get dizziness and lightheadedness, especially if you have POTS. So you have to be careful of the timing and how many needles you use. But there's great treatments for helping with things like dysautonomia and POTS, and also with irritable bowel and constipation and sleep and insomnia. And these are very common symptoms that you see over and over again, regardless of the reason that people are coming in. So acupuncture is a connection, a way for you to connect to the central nervous system. Most of that is parasympathetic, but there are certain points that actually deal with inflammation, with hormone balance, with muscle cramps. Like you can use points to help gear a different therapy for each person. The way I learned was French acupuncture, which was very meridian based. I'm not a 5-element acupuncturist, but there's tons of acupuncturists in Maryland. That's one of the things. They have more acupuncturists than gas stations in Maryland, mostly because we had Thai Sophia and Maryland University of Integrative Health here. So they're putting out a lot of acupuncturists. And so if people have access to it, I would really encourage them to try it, because the biggest thing with acupuncture is you have to be able to get there. So pick someone that's close to you. That's not going to be such a long drive, but there are so many people that are around, and obviously get someone who's reputable. But that input once or twice a week can really be, very, very helpful. I don't know if anybody else wants to share their experience with it, but I just have found that the more people do things like acupuncture, the alpha stim, which is a calming technique that induces alpha waves in the brain, use my sauna, use the lymph treatments that we have, the more we speak to that parasympathetic, that vagus nerve, the better and quicker people heal. It's not perfect. but it's better than not doing it, because your journey for healing, like you want to give your body tools to fix itself. And so those are the inputs that I use, like Reiki as well, to help the body heal itself. I think everyone should leave with Joyce's phone number today too. She's excellent Reiki.
Yeah, I think that's so important, because I think how many of us keep hearing about, all these different programs. There's one in Texas that my friend did, and she spent $6,000 for some POTS thing. I'm not saying it's not a bad program, but the crux of a lot of these things that are either being developed for our community, or the Gupta program, or all these different integrative therapies, a lot of times what they're doing is if I'm not mistaken, correct me if I'm wrong, is really helping essentially act on the nervous system, or something else that then affects the nervous system, which at the end of the day, that still affects the mast cells. And if we can calm the mast cells, then it calms a lot of our symptoms. So, but I want to say something about acupuncture. Now it's so much more accepted, just like PT, that a lot of times we can find places that are covered by insurance too. Yeah. So I even found somebody that is apparently, like, I don't know why the alarm going off, I'm so sorry. That's like near me, that is apparently one of the best reputable places in Frederick, Maryland, that, takes insurance, that I had no idea. But I just think it's, it's just amazing how far we've come, even just in a few years. I hope you guys can't really hear all that. But always try to check to see if it is covered. But if not, there are other, it's one of the, I agree. You have to be there, and you have to be able to go regularly to be able to hear it. It's just one part. And I'm sure other people are familiar with this too, is that Dr. Frank Amano always says that it's not that one thing will make you 100% better, but it's these, different things here and there that, will make you 5% better, then 1%, then another 3%, then, 10%. So if you find these things and they work together by the, in a short amount of time, which, it seems like a long time, but we're so used to, and we really do have suffered for so long, that 6 months of being consistent with a few things that do work, you could be 20% better, 30% better. But I think one of the things I've learned that has been the most hard for me in the last couple of years is really understanding that even my timeline, that timeline that I had in my head, that I used to be able to get things better or see benefits, it changes. It is a roller coaster, and understanding that even though we have done these things before, we are living this daily, and that things change, life change, hormones change. We still go through all the normal stuff too that can affect our bodies, and that the way that we do things might need to change up too, and things might take longer, shorter. We might need to try things that we didn't work for us before, or find another practitioner that maybe is better for us. But I would love to hear.
I think the other issue is that flares happen, right? So
yeah, oh yeah.
I had people who, they're doing fine on their regimen, and then all of a sudden, severe pain, allergies, what just happened? And I just had a patient this week. She basically her something was going on in her apartment, and her roommates, they used a different cleaning agent in her kitchen, and something as simple as using a different chemical in her kitchen induced a flare for her. And so when she came back from wherever she was, it was like a massive mast cell that lasted, flare that lasted about 3 or 4 days. And then we just adjusted some of the meds and got her out of the room. But a lot of it is that, these flares happen, unfortunately, and there's a bunch of triggers. So that's also part of the journey, is trying to figure that out. And that's where things like acupuncture really help, is that they just kind of calm things down when the flare happens. Reiki calms things down when a flare happens. These kind of inputs are really nice to do when things feel like they're out of control.
What's the acupuncture? And I want to make sure we open it up for anybody that has either questions that they want to ask, live if they want to, or they want to submit to us before we move on to the other, different kind of therapies that I know that you are aware of, and we can have more of a discussion about different things too that you offer in your practice, and other new things that we've heard about. There's not with you, but with an acupuncture, I think years ago, that, and maybe somewhere else, they attach this, like, it's almost like a TENS unit.
Yeah, so it's
what is that?
It's electrical frequency acupuncture.
Okay.
So electrical frequency, you can adjust the hertz on that. So basically you connect it to the needles. It helps with movement of energy. You can use lower frequencies to kind of give stronger inputs, so treatments last longer. You can use higher frequency to blunt pain responses so that the pain can go away. using certain frequencies over certain points like the back and certain gallbladder points. I do it sometimes just if a person's in a flare, I just use these points and at a higher frequency, and the pain just kind of calms down because you're just telling the body, because remember, peripheral nerves respond to the needles, which then communicate to the spinal cord, which then communicate to the brain. So there's, central pain syndromes, there's spinal pain syndromes, there's nerve pain syndromes, there's radicular pain, there's peripheral pain, there's all sorts of different pains. But the way you can start communicating with the nervous system is through these needles, and the frequency, the electrical frequency can modulate how much, like in terms of which neurotransmitters might be able to be released, which pathways you want to try to affect. And it actually adds to the duration. I feel like people get a better response, a longer response when you're using electrical frequency.
And it's not the same as it's from what I remember. I haven't had it done with acupuncture in a long time, but it doesn't feel like a TENS unit, because sometimes a TENS unit can be quite intense for some people. And it's also not the same as even dry needling in terms of like, you think about a needle in your body, and that I don't know how many people have had dry needling before, and it's either pleasant or not, but to me, I would think it's,
sometimes dry needling is used to release a spasm in a muscle group.
right, the PTs
So you can,
use it.
the trigger points, you can try to basically use a dry needling technique to try to get that muscle to spasm, to constrict, and then spasm, and then release. And that can be a little uncomfortable when you're going through it. But typically acupuncture, the traditional acupunctures are not meant to be uncomfortable. In fact, it should be very relaxing. It should promote, sleep. It shouldn't be painful. None of that should be uncomfortable.
Right. And when they do that with the radio, am I saying the right word?
It's just electrical frequency.
Yeah, it doesn't feel the same as a
no, it's not like a shock or anything.
Right. Interesting. All right. Does anybody have any questions or specific questions regarding acupuncture that they either want to submit and I can ask, or you want to ask if you want to unmute your mic and video to Dr. Rao before we move on to something else? You're also welcome to submit other complementary and alternative therapies that if you're a question that we can ask when we move on.
I have a question that could relate to acupuncture as well as the other therapies. A lot of people in the group have bloating issues.
Mhm.
And once somebody say cured their SIBO or ruled out a lot of other GI issues, what would you recommend, or what do you see that would help, or how would you treat acupuncture wise or with some of the other therapies or look into for bloating?
So fundamentally, bloating to me is probably some sort of digestive process issue. So first we look at, do you have enough stomach acid? Not having enough stomach acid, you can't break down your food, you can get so bloating is a sensation that there's gas and distension, which usually come from the gut bacteria, trying to break down the food. So is the process of digestion proper? Do you have enough stomach acid? Do you have enough enzymes? Are you eating the right foods? Are you eating foods that are difficult to break down for you? Should you take a digestive enzyme? Should you take a DAO enzyme to break down histamine? Do you have bad bugs? Should we treat it with herbals to look for dysbiosis? Is the motility okay? Is there a role for LDN in terms of motility and gastroparesis because food isn't moving, which is what's making you bloated? So those are kind of the fundamentals of things that I look at. Aside from things like, dysautonomia and other issues, and specifically, mast cell type of targets. So we look at digestive systems, the way it's working. Do you have enough of these things? Do you have bad bugs? Do you have bad yeast? Do you have a parasite? We look at stool tests. We look for overgrowth in a breath test with SIBO. We can look at gastroparesis indirectly. I mean, traditionally, you have to go see a gastroenterologist to do that test, but lots of people, are typically at some spectrum of gastroparesis, especially if they have constipation as well. So we work on the vagus nerve, and that's where the acupuncture can really help. We're promoting vagal tone, you're promoting digestion, you're helping your body move. The MMC component is a big part of, sometimes it's considered autoimmune. So is there an autoimmune component? So we do blood work. We kind of go after, for everyone, I start at the gut. I just look at the gut, try to look at the food sensitivities, look at stool tests, kind of the foundation of where we start. If it sounds like mast cell, we start working on mast cell. We also try to do things to help improve digestion by adding those things we talked about. There's not a perfect test, but a baking soda test, which is where you take a teaspoon of baking soda and 8 ounces of water, and you take it for 3 days in a row. And if you don't burp within 5 minutes of taking that test, typically you don't have enough acid. And, a lot of people who are using mast cell protocols are on antacids, right? They're on Zantac or Pepcid, and some people are even on omeprazole or the PPIs, and that really lowers your acid levels. So as you lower acid, you're also lowering your ability to break down certain foods. So do you need help with digestion would be kind of the fundamental question. And where along the line are things breaking down? Do you have intestinal permeability? Is there a leaky gut picture? And that shows up indirectly also if you do your food sensitivity test and everything lights up like a Christmas tree, then chances are you have intestinal permeability or leaky gut, which is then fueling some of this problem.
Yeah, and it's such a hard question. I know so many of us deal with it. And it's also could be the type of food that you eat, not necessarily how healthy it is or what diet, but like I know for me with gastroparesis, I do so much better if I could just drink and eat liquid. Like it seems like anything will make me
fundamentally
miserable.
what you're saying is you can't break the food down, right? So if it's
Yeah,
a
I mean,
little
and that's
broken
how it
down food,
feels. I mean, and I, as frustrating as it is, I don't know if anybody else feels this way, but it's just a constant battle. One that when I work with a personal trainer and they want me to track my diet, I'm like, you don't want to go there with the diet with me.
yeah, so enzyme deficiencies are real. Pancreatic, exocrine pancreatic function, I see a lot. It's basically the need for prescription level enzymes when you eat food. It's not the over the counter is not going to work. Sometimes the DAO enzymes help people break down the mast cells, or like at least help the mast cells stay stable and break down the histamine levels. But other times you need a prescription. You just do. And so that shows up on the stool test because you don't have enough that elastase enzyme. So when you eat anything that has fats, proteins, or carbs, you may not be able to digest it unless you juice it. If you're juicing it and it feels great, and maybe even a smoothie, smoothies are a little bit harder because they have a lot more fiber. Your gut bugs have to break that down. That you should tell you that there's a digestive issue. There's a problem with digestion somewhere.
And way before it was popular, intermittent fasting was like, I joke. I mean, I don't know if anybody else feels that way, but I mean, because you'd be hungry, but I mean, before it was popular, I feel like that, intermittent fasting was a lot of times developed by our community with that gastroparesis of just trying to like deal. But can you talk a little bit about like that? Is that something that you also see as helpful for patients?
Intermittent fasting?
Yeah.
So I'm trying to think. So definitely for SIBO, I think most people, there are some subsets of people so intermittent fasting can look like anything. It can look like time restricted feeds, which is I don't eat for 12 hours, or I don't eat for 16 hours, or periodic fasting, which is every 2 days a week, I'm on 500 calories, or I don't eat 2 days per week. That's called periodic fasting. And then there's periods of fasting like a water fast or Prolon, which is like a marketed 5-day fast that mimics a water fast. These do have the potential to change your immune system. They do help. They are very, very helpful, but it doesn't work the same for everyone. So I'm a big proponent of fasting in my practice for many things. It works for high cholesterol. It works for high insulin levels, for prediabetes, for lowering waist circumference, for lowering markers of inflammation, for lowering something called IGF-1. But what it does is it speaks to the immune system. It changes your gut bacteria. It creates resilience. And if people are able to eat beans, that Prolon program is pretty good because a lot of the soups have like minestrone and those kind of things. But it's a 5-day fast, which mimics a water fast. It's very challenging to do a water fast. Water fasting is tremendously helpful when you can do it for about 5 days or longer. There's clinics out there called True North that are now, I think, all over the country, but they started in California. They have fasting regimens for 1 week to 4 weeks. So 4 weeks of a water fast where you're observed and you're taken care of. But people come out of there, I've had patients who've done these, they come out of there amazingly transformed. A lot of their medical problems, because a lot of it is a dysfunctional immune system is setting it up. And so fasting can change your immune system. The hard part is knowing what kind of fast will affect your immune system. Not everybody will respond to time restricted feeding, but it's not a bad place to start.
Yeah, I think that's such an important point also, because I think when we're talking about fasting, there's so many different types, and what we're talking about, context matters. Like you said, for me, I'm thinking of just not eating until 12 o'clock. So you give your gut a chance to like just heal from trying to digest so much food. But you bring up a lot of really good points, you know, in terms of the different types. And like with this community, with gastroparesis, eating is can be so hard, and we're already a lot of times nutrient deficient. So it's a balance, right?
Yeah, so speaking of nutrient deficiencies, the other thing that we promote are IV nutrients, right? So IV vitamin C, B vitamins, magnesium. We usually do nutrient testing for people, but that's another way to get in nutrients is through the vein, through patches, through skin, right? So there's a company called Patch MD or MD Patch or something that has transdermal vitamins that you can take, that you can put through your skin, vitamin D, vitamin B, there's a lot of them. That seems to help some of my patients too, because the gut is not a great place to get nutrients. Like if you're not able to eat the way you want and you're not able to take the supplements because you get bloated with the supplements, you're intolerant to the supplements, sometimes you're not absorbing the supplements, need other ways to get the nutrients in. So those are some other variables, but yeah, traditionally you're looking at, you know, gut health, nutrients, and hormones as like big categories of things that are off. And ways to impact those can sometimes help everything, including mast cell function and pain tolerance and everything.
Somebody has a question that's asking about, can acupuncture help with detox relating to heavy metal and the gut?
I've used points for detox. I've used like, you know, liver meridian and gallbladder meridian. I think they're helpful. I don't use them solely for it. I use things like lymph treatments, which we do at the office. We have a machine that works on the lymph, which are the lymph nodes are like the nodes that are all over your body that basically are your garbage disposals. They collect through the channel, the lymph channel, they collect all the wastes that are happening, all the things that are debris and byproducts. And as we age, we are more stagnant in getting things to come out without even having more illness. Our lymph system gets more sluggish as we get older. So using things to help you detoxify, like the sauna, like sweating, using things like the lymph treatment and even like a rebounder, which is like a little trampoline that you can jump on, a lymph brush that helps you drain. They can all open up your lymph channels. And we have lymph nodes all over us. So you want to use things that kind of promote lymph drainage all over the body, not just, you know, in the head and neck. I like things like dandelion tea, milk thistle tea. I use a lot of detox protocols in terms of supplements. Those are what I go to more. I think acupuncture might be adjunctive, but I wouldn't say that that's my main part of a detox. Even things like Epsom salt, for example, is helpful for detox. Epsom salt.
And that's something that we can do at home.
Yeah, baking soda, Epsom salt is really nice detoxes. You can do it in a bucket. You don't even have to get into a bathtub. Those are helpful for detox. It also, you know, heavy metals and mold, they're not subtle. Like you have to be able to bind them, open up your garbage disposals. You have to be able to support your liver. You have to be able to have no, you know, you got to get it out of the gut. So you can't be constipated. That's another big problem. You can open up your liver, but if you're constipated, then that stuff's not going anywhere. So it's kind of like working on the GI system, including the liver and the gut, working on your skin, drinking enough water, using binders, using things that open up the lymph channels. You know, it's all part of it. I think acupuncture doesn't hurt, but I just wouldn't think it's a main part.
Right. And I think that it's important that you mentioned that there are things that we can do at home. If somebody can't tolerate like an infrared sauna, or they don't have access to it, or they don't have the money to do it. I actually bought one of those infrared sauna blankets. I haven't used it, but if somebody can't tolerate that, you know, they can do the dry brushing. Is it wash out like with the, that you can kind of like, isn't that similar? You can do at home with Epsom salt baths or things like that.
Yeah, Epsom salt baths and baking soda are great detoxes.
And dry brushing for the lymph, like you said.
Right.
So moving, let me just make sure I ask that question before I move on to the next topic.
I also have a question from someone.
Just to Daniel, I don't want to interrupt you, but I just want to make sure I follow up to what was asked before.
Okay.
She mentioned, to clarify, she was asking if acupuncture could help as an add-on for somebody trying to detox with a gut protocol. So I would say that that's yes. Okay.
Yes,
Daniel.
because it will absolutely help the vagal tone. It'll help you digest. It can help with gut motility. I think also potentially Reiki might be a little bit better for something that involves gut motility.
Danielle, do you want to go ahead and ask?
Sure. And we have one question in the chat, but there's another one that's come up. And this may be a broad question. So many people have fatigue problems and brain fog. And to some extent, sometimes those are related, sometimes they're not. But what would you recommend for fatigue and brain fog in terms of, say, acupuncture or other therapies? Do you have sort of a preference, or how do you get somebody started to get so they can actually sleep and think?
Right. So with that, no two people have the same reasons for fatigue and brain fog. So a lot of it is personalizing it through, acupuncture will absolutely support your adrenals, whether it's chronic fatigue you're dealing with, whether it's candida overgrowth, whether it's bacterial dysbiosis, a parasite, whatever's causing that gut-brain connection to be an issue. It could be post-COVID. There's so many reasons to have fatigue and brain fog. So even hormone imbalance can do it. So part of it is collecting data. That is actually a perfect person to have start with acupuncture while you're collecting data, because you can support the adrenals, you can support different pathways, but I can't say that it's going to be the end all be all, because part of it is that you have to find out, what is the reason for it? Is it because you have a bad bug? Is it because you have, some sort of like a immune system dysfunction because your body thinks you have Lyme or mono or a virus? There's layers and layers and layers of this. So that is not an easy question to answer. That's someone, usually I work with them for a long period of time, because we need to find and isolate what the problems are. Oftentimes it comes into something is in your system that shouldn't be there, or you don't have enough of something that should be there. It's more common that you have something that shouldn't be there. So finding out what that something is, whether it's a toxin, whether it's a metal, whether it's a bug, whether it's fungus, whether it's a mold reaction. That's the hard part, is like really have to find that out. But in the process, absolutely, you can do things like detox. And like I said, some of the stuff that we talked about is supportive for everyone, no matter what. It doesn't mean it'll cure you, or it doesn't mean it's the main treatment, but it's a supportive treatment that can help you at least get sleep, or get, if you're in sympathetic overdrive, because you can be wired and tired. You can be completely exhausted, but be completely wired when you're looking at the bed at night. So that's that different adrenal kind of pathway that you still need your adrenal supported. So, whether it's the hormones that we can use, I've used pregnenolone for the brain. I've used hormones. I use nasal sprays that have B vitamins and ginseng that kind of wake up the brain. I've used it in conjunction with mast cell. LDN is my favorite. Almost everyone I see with EDS or mast cell is on LDN, because it is a great calmer of the mast cells. It's a great prokinetic. It helps with gastroparesis. It helps prevent SIBO. It has so many functions. So I'm a very big fan of LDN. And for neuroinflammation, which is what I think brain fog is, I think that should be part of it, part of the journey in terms of finding it out. It could be yeast overgrowth. That's very common to have an overgrowth of yeast. So again, it has to be tested. But at the same time, doing detox protocols and doing acupuncture can only support it, but you have to get tested and kind of see what your issues are. Otherwise, part of the time you'll just kind of go in circles because you're not hitting the right thing that's there. You could be living in a house that has mold, which I've had patients that it's happened for, and that's why they're never getting better. So it's not everybody, obviously, but it's a journey.
Okay, thank you for that. That's some excellent suggestions and points. But I think what I hear a lot about from group members is they've gone through the route of doing a lot of that testing and ruling out this and ruling out that. And they get very frustrated because they can't really get to the bottom of the issues once they start eliminating a lot of the things. So it's good to know that some of that will help.
LDN is really great adjunct to most things. Also, I've been using nasal sprays. Like I said, it's called synapsin. Synapsin has ginseng. It has B12. It can help with brain fog. And then there's this whole big area that Kendra and I have touched on is peptides. there's a whole world of peptides that are very, very helpful for different things, like an immune system that's out of control. And some of the examples I can give you that are very, very well used in the mast cell world is BPC 157. It comes as an oral agent and as an injectable, and it works really well when it works on the gut because it's very healing. It's kind of, be used for inflammatory bowels. It can be used for leaky gut. It can be used for IBD. It's not a cure for everything, but it can be used, especially to get people off of PPIs like Prilosec and Protonix. It's a very good antacid. It's made from gastric juice, healthy gastric juice, and it's very, very healing. So we've used it as injections into tendons that don't heal. Works really well with that. It works with neurological issues. But there's also things like cerebrolysin and thymosin alpha-1. There's 85 different peptides out there. So that's a whole new world in terms of therapeutic options that I didn't have before. It's just kind of it's coming up. It's a new world. So I don't know if somebody is frustrated about not moving, they can talk to their providers about maybe trying these things like peptides or LDN or nasal sprays like synapsin, which give you a little boost to your brain while you're trying to figure out what else is happening.
Okay, great. Thank you so much. I don't know what you have, Kendra, but we have the one question in the chat from somebody about what are your thoughts on prolotherapy? And I would also add maybe PRP into that.
Yeah, I was going to ask that question so Dr. Rao can talk about that. And I have a list of, I'm trying to be cognizant of time too, but also make sure that we touch on these different therapies that
Yes.
I think people will be interested in, but also I know that Dr. Rao knows more about. So don't mean to fireball you, Dr. Rao, but we'll try to go through it. Yeah.
So, they work, first of all, I think in terms of treatments like prolotherapy and stem cells and all that, you should definitely go to someone who does it often, does it all the time, because they're very expensive and they work really well sometimes for ankles or smaller joints that have a really hard time with healing. Or like the stem cells work for the spine and the hip and those things, but not for everyone. And so I don't claim to know all that regenerative medicine as much. We do exosomes in our practice, which is type of a stem cell-like derivative that helps with the immune system, but it's targeted for people who have specific types of pain syndromes, spinal cord pain, and it's in the world of regenerative medicine as well. But it has to be targeted to what people are having. Like not everybody's going to respond the same. And I would really like for people to see, I don't know if you have names, Kendra, of people who do prolotherapy, but it should be someone who's kind of doing it all the time. I've just seen mixed results with prolotherapy. I've seen mixed results with stem cells. If they're not covered under insurance, they're quite a bit of money. And I've seen people get it multiple times in the same joint, like hips and things like that. I use ROSM, their pain management group. I don't know if they do prolotherapy, but they're not surgeons, but they do regenerative.
Physiatrists.
They're physiatrists.
Yeah, they're physiatrists. I know exactly. Treatment. Yeah.
Yeah. And they're I think around the country, they're like a franchise type of thing, but they do it in a way when they pick the client, I feel like that's the right client for them. So ROSM, I believe their consults are covered. So definitely you can make everybody verify this because everything changes all the time. I feel like the consults are covered, but some of the therapies are not, like stem cells and PRP. And we used to do PRP as well. It just doesn't work for everyone all the time. It has its role. I've seen it in my lectures and my colleagues that are using it, they're using it in layers with other things while they're, nutritionally sound, getting people nutritionally sound, hormone balanced, getting their gut clean. They're also doing stem cells and they're doing these things in layers, using the peptides and all of that. It's not in isolation, so stem cell will work. That's the problem.
Still has to be just kind so of people know what PRP is platelet rich plasma. Yeah, and it's interesting because to the people that are asking about prolotherapy and this PRP, like these things have been around for a little bit of time. That practice used to share an office in Rockville with physiotherapy associates. This was a great physical therapy practice that a number of PTs that knew her from hypermobility were there. And one of the I believe it's the same practice. Unfortunately, one of the doctors that was there that knew EDS well, and this was again several years ago, passed away. But I believe maybe some people still go. I'm sure other people might be able to give a recommendation. But prolotherapy and this PRP have been one of those things that I've heard great things about over the years. But I think it's been kind of hit or miss in terms of who it works for and who it doesn't, and can be very expensive. And then there's all these other different things that have come out too. But interestingly, some of this stuff is also crossing over. I don't know if anybody's into the skincare world. I personally am interested just because I like it, but also our skin is, very important. But as we get older with EDS, it's very stretchy. So I know they're using PRP in skincare facials too. So
Yeah, they call them vampire spay facials because what PRP is you take your own blood, you spin it down, use the platelets, and platelets are highly regenerative. So you can inject them into places like, under the eye to regenerate collagen, basically. You can put it on the forehead to get rid of wrinkles. You can use it over the whole face to kind of decrease wrinkles and all of that, because it's actually causing your own collagen to come back up. So it's kind of considered more natural. So yeah, they use all of these things. They use tons of regenerative
hair transplant too. I heard it's really good for for people that lose their hair.
Growth. Yeah, it's very painful when you're doing it on the scalp.
Somebody asked, could you repeat the name of the nasal spray?
Synapsin.
Is it with a C?
Synapsin, synapsin.
Synapsin. Is that something that people need a prescription for, or they can just find?
It's prescription.
Okay. Just kind of like the peptides, like you talked about, like.
No,
BBC.
synapsin is RG3,
Okay.
which is a specific type of ginseng, and it has methyl B12.
Oh, so would that also, I guess that's probably why it helps, because maybe it helps with ADD, ADHD.
It helps more with brain fog, and it's very good. It's very well used in the concussion world for people with concussions. And I used it for one of my patients who's a college student, and he was able to finish his semester because of that nasal spray. It was very helpful. But it doesn't work the same for everyone.
Right.
It's again another tool.
Something I didn't know, just like BPC. I don't know if anybody else had heard about the BPC 157. That was just something that Dr. Rao and I had recently talked about. I was like, have you heard about this? I heard some people in the EDS world talking more about it, but again, that's something else. These peptides in this world of peptides is also something that has to be done by prescription. So what about, can you explain a little bit more about when you talked about Reiki? And I know a lot of people know what Reiki is and they do Reiki, but the difference between Reiki, craniosacral therapy, and other energy medicine modalities, like, I've had energy medicine done where somebody just sat over. I guess it's kind of like Reiki, but I've also had craniosacral. And then there's also things like tapping and different things like that. Can you talk about those different type of energy medicine?
Yeah, I can. I'm not the world's expert. So Gina Sager is my colleague. She is a retired surgeon. She does a form of energy medicine called Donna Eden energy medicine, which I've taken maybe 2 hours of class in. So it is, it's using different movements, different tapping points. It's remarkable. And I would really encourage people to learn more about energy medicine because it puts control back to you. Donna Eden was a woman, I think she has a school in Frederick, but she healed herself from multiple medical problems. And my colleague who's a surgeon, a very type A surgeon, she was a very type A surgeon who thought, if it's broke, just take it out. She is now doing, she's doing energy medicine and Ayurvedic and all of these other things because she believes how important energy, the role of energy and meridians and chakras, whatever you want to call them, we are all vibration, right? So part of it was she truly feels that it's the missing link. She has a website, ginasager.com. She does consults. I would encourage people to see if this is right for you, but she uses a form called Donna Eden, which is a form of energy medicine using movement and tapping. But she does a thorough analysis. She does a full 1 hour evaluation to see which one of your energy meridians are off. And then she targets treatments to that. So it's not very simple in the sense of people really need to know what they're doing to do it right. But at the same time, it gives you back some power because you can do these different tapping. Tapping is oftentimes on acupressure points. So I really think that there's this overlap that you're speaking to some of the big acupuncture points. So for example, kidney 27, which is right here. This is a great point for when you're tired. This like wakes up all the energy in your head. I use it all the time for patients who have dizziness and lightheadedness, tinnitus. There's a morning routine that that Gina Sager taught me. That's just a series of points that you just do every day in the morning, and you wake up all the chakras, you wake up all the meridians. I mean, when you do it, it doesn't take very long, but it really works. Like it really does get you energetically feeling better. I mean, it's not like you're going to go and run a marathon, but it opens up all your channels. And as an acupuncturist, I know that the channels, the stagnation of the energy moving through the channels is what causes symptoms. So acupuncture is a form of energy medicine. Tapping is a form of hitting those points that it's almost like you're accessing the organs that are stagnant. Like the spleen is often stagnant. The stomach is often stagnant. You can use these peripheral points to kind of hit the energy, the nervous system of that organ in an energetic way. So it's not like your spleen, when acupuncturists say your kidney is not working, it doesn't mean you're going to need dialysis. It means that your yin, your vitality, your sense of like, get up and go is down. And so that's a different kidney than the traditional medicine. So you have to kind of parcel things out when people are talking about spleen and stomach and liver. So many people panic that walk in when their Reiki person or their so-and-so tells them that their liver's off. They're like, oh my gosh, I'm going to need transplant, I'm going to need dialysis or whatever. It's not the same issue at all. So just remember that there's a difference between energetic organs and traditional organs. But I think these are fantastic ways to help people gain control of things back for them. So, but there's different people for these resources. So I'm the only real training I've had for energy is in acupuncture. I've kind of tiptoed into the energy medicine, tiptoed into the chakras, the tapping, but I don't know it all very well, but they all are very useful. The only other form of Reiki is a form of energy healing that has to do with the energy of the provider hitting your energy. And there's sometimes no touching, like she doesn't even lay her hands on you. And she's, Joyce, which I'm happy to share her contact info because she's incredible. She can actually sense, when she was working in my office, just to give you guys an example, she'd be walking past my room and she would stop and she'd say, what's up with that, black energy going on in here? Like when I was in a bad mood, she would know by just walking past.
She does. That was my experience with her
crazy.
too.
It was crazy. I'm like, how do you know? And she's like, oh, your spleen's off. And then she would just, tweak my spleen.
Yeah, she one time I did something with her and she just, as a side note, I didn't say anything and I was just laying there and she walked in and she immediately went to my pelvic area, not necessarily my groin. And she's like, you have a scar. And I was like, what are you talking about? I have a scar, which I do, but she didn't know. And she's like, it's tight. Like there's scar tissue built up. And I'm like, what are you talking about? So sure enough, she's talking about where I had my hernias repaired. She's like, it's tight. It's like pulling. I'm like, how? I didn't even talk to her. I didn't even.
So that brings up a good point that scars need to be treated. They need to be treated. They're blockages of energy. So scars should be treated either with acupuncture or with Reiki or with even like Traumeel, topical homeopathic. Scars hold a lot of trauma in them that inhibit the energy flow. So, say you had a scar after a C-section going this way. A lot of the meridians go this way. And so they're all blocked. And so you have all these other things that are blocked peripheral to the scar. So you would never guess that it's the scar, but once we treat the scars, I'm including this as emotional trauma can be held in the scars. So, scar treatment is a really big deal, especially if you see an acupuncturist, make sure they're dealing with the scars on your body because it's a very big it holds back healing a lot if you don't heal the scars. You'd asked me about one other thing. I don't know too much about craniosacral, sorry, because I've just used Reiki through Joyce. And she does.
Sometimes it feels similar to craniosacral. And I've had presentations on craniosacral. Yeah. It's a different thing.
I don't know. I enjoy Reiki better. But craniosacral doesn't feel like anything to me. I've had it twice. I've never felt anything with it, but that's not to say that people shouldn't try it. I would trust Joyce to know what to do because I think she knows craniosacral.
Yeah, she's I know we both are talking about Joyce and I laugh because she is just that person and she really just has this energy about her that is kind of like, you kind of think it's voodoo. Like, it's like just crazy how intuitive and how healing she is. And I believe that some people are just like that. My older son saw her And then I told you my scar thing, but also I will say, I think I've shared this before with the group, that tapping, years ago, we were taught by child psychologists and child occupational therapists for my son, my younger son with sensory processing disorder. And it was one of those things that we were told to try to do, and we didn't really understand it. I don't know how she was trained, but I remember my husband being like, what is this thing that we're trying? And he didn't believe it, but we did these things and we just did it. And it was like a light switch before he could even talk of how much you can't make this stuff up when it works, because he certainly he couldn't even speak at the time, but what it did for him and what he was going through was crazy. And to the point that even years later, as like a 12, 13-year-old, he brought it up and was like, hey mom, can you do that like tapping thing that I used to do when I was younger? And it helped me calm down. And I was like, oh my gosh, he remembers that. Like, it was just one of those things that I was like, I was struggling, like, is this really working? Like,
Well,
but
I
it
think
does.
all of these things speak peripherally to the central nervous system. They're kind of waking up spots in the brain that are they're asleep because everything's been chronic. And so chronic things on the brain need to be rewoken. And so acupuncture needles do that. They wake up points. They cause the body to create inflammation around the needle, wake up the cytokines, the immune cells that say, hey, there's something here that shouldn't be here. The brain says, oh my gosh, what is that thing? Where you've had pain in some place for more than 6 weeks to 3 months, it's a chronic problem. Your brain's forgotten about it. So you have to wake up these areas. And I think things like, chakra work and things that are like tapping, they're using your peripheral skin to relate to the central nervous system through these portals called acupressure points or acupuncture points, or these chakras. They're like portals that actually communicate directly to your central nervous system, to your vagus nerve, your autonomic nervous system, your central nervous system. I think, Kendra, you have a talk that you did with Gina Sager. It's probably in
we
your
did.
EDS archives.
And I'm happy to share that all with, if anybody's interested, and I'll give it to Danielle of previous talks that Dr. Rao has done on acupuncture, Wellapalooza, and the different ones. But there was one that you, me, and Gina sat down with and did in your office. So I'm happy to share the links if anybody's interesed. And there's several.
Gina also has some podcasts on my website as well. She's done 3 on the concept. So if anyone wants to learn more, they can go on there as well.
Well, I want to be cognizant of time, and I know that there's so many other different complementary and integrative therapies. If anybody has one specifically that they would like to ask, I'm happy to ask. I know that there's a couple that you offer in your practice that I would love to learn a little bit. If you could just touch on and say how they work, that would be great. But let me make sure I ask the questions that anybody has. Okay, so we mentioned a sauna. We talked about infrared sauna. And I don't know that everybody understands why the infrared sauna versus sauna, if there is a difference or how that works, but a lot of us can't tolerate the heat, especially if you have POTS. What would you recommend for somebody with POTS who's starting out relating to frequency and duration in terms of infrared sauna?
That's tricky. I mean, a lot of times when people heal, I don't do too much of the sauna. So maybe 5 minutes at a time, drinking lots of water, having electrolytes in your water. But if you're not sweating, then I don't like the sauna for you. I feel like sometimes as we get people better, they sweat better, they sweat more appropriately. So the sauna isn't right for anyone who can't sweat. You can't do it for very long because otherwise it's just not the right, your body temperature just goes up too high and it's not safe.
Yeah.
But you can do things like lymph detox. You can do the other things to promote lymph drainage. Sauna is one way. The infrared light, you can maybe lay on a biomat, which also has infrared light. That infrared light tends to
like the red light therapy.
It's red light therapy. It's infrared light therapy that lowers cortisol. It helps with pain. In fact, now we have a machine that looks like, like a little pad that's called photomodulation, and we can put it directly in areas of pain. That seems to help. We just had someone who broke their foot and she did infrared. She did that photomodulation and she healed really quickly. So it's a focal treatment to lower inflammation. It penetrates the muscle. It can penetrate through to the bone level and induce healing, the light therapy, the infrared light. So that's a great modality also to help promote sleep and lower cortisol. And so you could do that through a sauna, you could do that through a biomat. So if someone doesn't sweat, maybe the biomat is a better option for cortisol lowering. usually when you're laying on the biomat in my office, you're getting either acupuncture done or alpha stim, which is the alpha waves in your brain are stimulated that mimic meditation. And when the alpha waves in your brain are mimicked, you can also lower inflammation in your body. You can lower cortisol, you can lower these inflammatory cytokines that occur because your brain is inflamed, you're stressed out, you're anxious. Typically those stress responses you can do at home with meditation as well, right? Meditation is available to everyone. Breathing techniques also induce alpha waves. So Kendra, you must have some information for people on that, right? And
Yeah,
some
I
overview.
absolutely, I think the question about whether if somebody can't handle a sauna or infrared sauna, that there are other ways to get that infrared that is really, I mean, there's been a lot of research that has really backed it. You know, I don't know, I bought a red light, you know, in my makeshift of trying to make it cheap at home. Is that just as effective if I'm buying a red light versus one of these contraptions that are hundreds of dollars? I mean, it took a way to get it. I mean,
I don't know that, I don't know, but I do think it's dependent on the quality of the instrument, how deep it goes, the penetration. It also infrared light and red light are different. So infrared tends to penetrate a little bit more than red light. But you know, chiropractors have some of these pens that they use for different treatments. And I don't know that they're that expensive. I would still go with something reputable because I don't think everything's created equal.
Yeah,
It doesn't have to be expensive. It just has to be reputable. The ones we have are for professional use in terms of, but the biomat anyone can get. And
Yeah.
that's pretty helpful.
So you mentioned the alpha stim, you talked about that. You mentioned the red light therapy. I know that there's the is it the LED lymph thing?
Yeah, so the lymph, yes, the lymph treatment is, it uses light, sound, and vibrational energy to move the lymph through the body. That's been really, really good for detoxifying from anything, whether it's mold, mercury, just fibromyalgia pain, because a lot of fibromyalgia we think is toxin issues, mitochondrial issues. So that's very helpful. It's really, it feels like a massage. You get it, it's a full body treatment. It speaks to all the lymph nodes, and you drink a lot of water, and your body just gets rid of the junk through the lymph system. So that always feels good. It's like, you know, finally having a bowel movement if you haven't had one, so all those toxins are leaving. So that's always helpful too. That's another way to detox if you can't use a sauna.
Are there other, we talked about the BPC, are there other integrative therapies that are coming up that are showing a lot of promise or research, not just like for our community, but just in general, and being more accepted in the traditional medical world as a therapy?
So the peptides are really, really exciting in the mast cell world, because the thymosin, TB4 frag, I think KPV, these are different, they're letters, but they seem to have some mast cell function issues while modulating the immune system. So they modulate the immune system kind of like LDN, but a different version of it. So anything that helps with the immune system, because sometimes people with EDS or mast cell issues have a chronic underlying some sort of an occult infection that their body can't clear. And so the thought used to be like a whack-a-mole approach. Is it Lyme? Is it Babesia? Is it virus? Is it parasites? Is it all of this stuff? Then the thought is now, why don't we just fix the immune system so that it gets rid of everything that it has? And so some of these peptides are targeted for immune function, which I think is really exciting. So that's something to explore in terms of mast cell and immune function, especially for the chronic fatigue world. It seems to be doing really well in the chronic fatigue world because chronic fatigue is thought to be an immune dysfunction, like an overactive cytokine approach. I mean, post-COVID has really brought that to light, that after a viral infection, you can be sick. And that's usually something that happens to people. They have maybe a genetic predisposition, maybe not, but something hits them, a virus, a stressor, an accident, something, and then boom, their cytokines and their immune system just goes crazy. And so they have this persistent fatigue and other type of manifestations. So because of that, we want to target the immune system. Where's the immune system? It's in the gut. So 80% of it's in the gut. You want to make sure your gut's whole and treat all that, but then you also can work on the immune system through these things like LDN and peptides.
And it's important for anybody to know whether or not you have HEDS and you know the actual genetic cause, or you have another type of EDS or another connective tissue disorder. I mean, the belief is the mast cells are in the connective tissues, and the mast cells help modulate the immune system help modulate the function of the connective tissues. So you might have come to the table with something like classical EDS, but if your immune system is off, that the idea that's, if you can, I wish I had my drawing, that if your mast cells are off, they're going to just make anything that's already just unstable, just even more unstable. But then also, if you don't have something, and then something triggers that, it just makes the whole thing, it makes everything unstable, and it makes the whole, mind-body connection, which is literally and figuratively there, affected. And that's why so many of us, we talk about, we feel like we're literally falling apart, but there is some truth to that in the way that the mind body works together, and the way that our nervous system and our cells talk to each other, and the mast cells and everything is modulated through the connective tissue. So, and it affects how the connective tissue functions and works. So let's see. Did I miss anything? I know there's so many different therapies, and I always have all these questions that I send to Dr. Rao too. But the peptides, you mentioned them, it's exciting, it sounds awesome, but what is a peptide? What is it? Is it a supplement?
I just want to go back to the last thing you asked me too about the traditional world. I don't know what the traditional world accepts or doesn't accept, because I've been so out of it that I don't know. And most people that I work with are integrative. So that's the problem, because even yesterday when I was seeing a patient, BPC is like huge in the functional medicine world, huge in the integrative world, even in the mast cell world. And then I had a traditional doctor, tell a patient, don't take this. This is really scary. It's a banned substance on, for WADA, which is like high level athletes. That has nothing to do with anything. But, there's lots of things that are banned, steroids, for example, but, we give them all the time. So the point is that, this challenge I have is when we talk about these therapies and then people take them back to their traditional doctors and are like, no, like 50-60% of my traditional colleagues don't even know what LDN is yet. And so I can't speak to what a traditional practitioner knows or doesn't know, but I will tell you that in the mast cell world, things like LDN is very mainstream. Things like BPC is being used very often for gut health and for functional health in terms of skin and tendon, nerves and tendons. And then, even things like Pentosyn, which is an injection, it's a peptide. So peptides are amino acid sequences. There are new therapeutic, like insulin is a peptide, but if they're over 44 amino acids are building blocks for proteins. If they're over 44, I think it's 44, 45, I can't remember, they go into the traditional prescription world. For example, something called semaglutide was a big peptide being used for weight loss and for insulin resistance. Semaglutide, liraglutide, it was like amazing. Everybody loved it. It was a peptide in the compounding pharmacy because it was under 44 units. But they changed it now, so it's only available as a prescription. So semaglutide or semaglutide is also a Ozempic, it's Wegovy, it's traditional FDA-approved meds now that are being used for weight loss and for diabetes. But they used to be in the category of peptides until the rules changed. So these were everybody's favorites. People were going crazy with these in terms of the functional medicine world, because I've been involved with peptides now for 2 years, and that was like everybody's favorite. But then it was no longer a compounding pharmacy issue. Then it became a prescription issue, which the hard part of prescription is it's hard to get it covered. Like one of the semaglutides or something like that is, if it's not covered, it's several $100s for 1 month prescription. Whereas, like LDN at the compounding pharmacy is like $90. So when it was an amino acid or just a peptide, it was more reasonably priced. Now, granted, if you took 3 peptides every month, it'd be better if they got covered, if they could be covered on your insurance. So we do try to get things covered, but there is some overlap between peptides and prescriptions. Like insulin is a prescription, semaglutide is now a prescription. But these are in the world of peptides. They're just amino acid sequences. But if they're under 44 amino acids, they're in the realm of over-the-counter. BPC is actually over-the-counter. And injectable BPC is a prescription. But there are therapeutics, like I have been using a lot of Pentosyn injectables, BPC injectables for pain and inflammation. For IC, for interstitial cystitis, Pentosyn is Elmoron. That's what Elmoron is, Pentosyn.
You're so, light bulb just went off in my head. I used to sell Elmoron as a drug rep with Johnson & Johnson years ago. Yes.
So Elmoron used to be is given for interstitial cystitis at 500 to 1500 milligrams
Yeah.
a day for decades. And one of the biggest problems with it is it causes macular issues, right? You have to be careful. I've actually had a patient who's had it, who was on Elmeron for 10 years. But Pentosyn, the shot, is 100 milligrams. It's 100 milligrams, so it's not going to cause really anything adverse. But I learned about Pentosyn through an orthopedic surgeon who uses it for specifically knee arthritis. And he gets people, he claims, he gets people not to need surgery because he uses Pentosyn. So Pentosyn, a lot of these peptides have more than one role. They're just in the immune system world, or they build collagen, or they connect with a certain factor in the brain. They're along the pathways of regular enzymatic reactions that happen within the body.
And if I'm not mistaken, not to go totally cellular on people, but it helped, Elmeron, what it did is it helped repair the glucosaminoGlycan layer, which is the gag layer. It's like the protective layer in the bladder that, you know, has these holes kind of like leaky gut, but in the bladder that would allow the toxins to penetrate the epithelial wall and cause nerve reactions and everything. So I would assume that it kind of does similar in the body, and that's why it would help.
So it is
pain and
also
inflammation.
a mast cell stabilizer.
Which
That is
makes,
why
yeah.
I had somebody come in dire pain. She was in dire straits. Like, this is the flares that I just,
Yeah.
they're just crazy because they just come out of nowhere and we don't know what it is. She was in so much pain. I gave her 1 dose of Pentosyn and she was pain-free. She's been pain-free. It's been 3 weeks. So I don't know why it works for some people, but I know that she had a mast cell flare and this helped get her out of it. So I feel like there is a lot of hope in the peptide world, as long as the FDA keeps letting us prescribe it, because thymosin alpha-1 was a favorite in the mast cell community, but they pulled it off the market. So I don't really know why.
Well, and there is nothing that has replaced
mean-
Elmeron for interstitial cystitis since then, from what I understand. So, you know, from talking to Dr. Theo Harides like years ago, and he's like, somebody should be doing more write-ups. And I'm like, I knew it was a mast cell. And now we know that it is a mast cell a condition, which, you know, the world comes full circle, which is just so funny that I, you know, sold it and did that, you know, as a drug rep way before, as I was learning all this stuff. And then now here we are. So Pentosyn, okay, still needs prescription, injectable. Anybody else have anything else that they would like to talk about, integrative therapies or anything that you offer in your practice, Dr. Rao, while I'm seeing if anybody else has any other questions about
what else we do. We do the well, we're getting back into Avazia. Avazia was introduced to me by Dr. Claire Francomano.
Yes.
It's not quite a TENS unit. We had, you know, COVID made us change so many practices, but it was a modality that you can use for a local inflammation. The PTs that work with EDS patients have Avazia units. They seem to, and some people even have home Avazia units. They're just kind of similar to a TENS unit concept, but they work on restructuring the signals for the pain pathways to the local muscles and nerves. So you can use it just on your shoulder, you can use it on your neck, or you can use a handheld one that you can buy that you can pull out of your purse. Some of my patients actually used it all the time for like flares, that they would call it, that, you know, basically one part goes off, then the whole body goes off, kind of a thing. So you can kind of contain the flares because you're treating it early. That's something that we're starting up again in the office. We do the alpha stim, we do the biomat, we do the sauna, we have the vibratory plate. Vibratory plate is great. It's just a vibrational floor that helps build muscle. It's a little bit unsettling for me to use it for anyone with cervical instability, you know, in the EDS world, if you have that, because it is small amounts of vibration that could throw your neck off. I've talked to Dr. Francomano about this, and she says that people should just be able to wear it for anyone. They can do it because it's really helpful to build muscle. It's helpful for incontinence. It's helpful for bone density.
It's helpful for lymph drainage, if I'm not mistaken, too. Yeah.
Yes, and it's also helpful for peripheral neuropathies. So it's a really good modality, but she just said, you know, people just maybe need to wear a neck brace when they do it.
What is PEMF? It's another type of like, you know, frequency. What is, I'm probably butchering it, PEMF, like they have it in mats now. It's like this, you know,
I don't actually know.
I'm going to look it up. it's another type of like, I don't even know if you feel it, vibration. It's not as intense as a TENS unit. It kind of reminds me of Avasia, because Avasia, if I'm not mistaken, when Dr. Francomano did the thing at GBM a couple of years ago, Avasia you don't really feel. It was kind of this, radio frequency type of energy. I'm gonna look it up because I'm butchering it. So that I could ask him intelligently about it. But does anybody else have any other questions about other modalities, manual therapies, other integrative resources? I don't see any other. Let me make sure. Danielle, I'm going to look up what PEM. Go ahead.
There is a question from somebody in the chat about how about Zolar?
That's the medicine for
Or other
IgE.
biologics for
IG,
MCAS.
the biologic for IG is an anti-IgE, right? It's for mast cells or for acute allergies.
Yes.
Yes.
Yeah, I've seen it. I don't give it in my office. I usually have the allergist or the pulmonologist do it. It is, I think the first time or the second time you do it, you have to be in someone's office just to make sure you don't have like an anaphylaxis or flare. I don't know that it's wrong for people. It's just that I don't think everybody's a candidate. And it has to be, you have to figure out if your issues with the immune system would be something amenable to it. I usually have people refer to the specialist, either the allergist or the pulmonologist. Sorry, I don't know that much more about it.
Just back to my PEMF, pulsed electromagnetic field therapy.
I don't know.
I know they sometimes put them in those like the mats, like the infrared mats, or the mats like you have at the office. But I've read it's been some interesting, I believe, if I'm not mistaken, it's similar to like if somebody has a bone break and they get the machine that they put on from an orthopedic doctor. Yeah, it's similar in terms of how it works into that. I could be butchering that, but from what I understand, it's similar in the way that when you have like a bone break, they give you the thing that goes around to help the bone stimulation, pulsed electromagnetic therapy. I don't think that's what Avasia. What is Avasia? Like, what does it do if it's not exactly a TENS unit?
I will get back to you on that because they explained it to me multiple times. It sounds like a TENS unit to me, but
same. I'm just looking it up, and I remember going to the program at GBMC several years ago, and it was really exciting about the information that was coming out. But again, that was several years ago, and I was wondering about that. But I know people have done really great with it.
Yeah. Well, I like it because it has the potential for you to get it as a home unit. And so you have that ability to use it on yourself when you need it.
Yeah. Yeah, that's also what I remember about it too, is that people were able to get it at home, and those that did, did really, really well. And I don't believe that anybody that has used it is here in this meeting, or else I would ask them. But yeah, that's very exciting. I think that's kind of it. Dr. Rao, do you have any other last recommendations for somebody that is, EDS, MCAS world, looking to incorporate integrative complementary therapies and just looking to try to find their way one step at a time?
Yeah, I don't know if anyone's tried acupuncture. I always highly recommend it for so many of the modalities. I'd say everyone would be worthwhile trying some sort of energetic input, whether that's through energy medicine or Reiki or acupuncture. I just feel like it has so much potential. I like energy medicine and a little bit more than the other two, because I'm always looking for things for people to be able to do at home. And not need an appointment, but acupressure, tapping, energy medicine, they're all things that you can learn techniques for different issues. It might be worth investigating those kinds of things. Oh, the other thing I didn't talk about with you guys is biofeedback. That's fabulous to try. Those are things you can get. Heart Math has biofeedback, right? It basically uses your breath to control your heart rate and your blood pressure, but it is actually speaking to the vagus nerve. And so you can get these small units, you can get computer programs with little, let me see if I have mine somewhere. Yeah, they have these like little units that hook into your computer, and then this part hooks onto your finger, and it can sense when it's about coherence. It's trying to get your pulse, your heartbeat, and your breath work to happen at the same time. And coherence helps with activating your parasympathetic, increasing your heart rate variability, which everyone should increase their heart rate variability because it is absolutely essential for our well-being to have a high heart rate variability. So these kind of techniques are really also helpful for POTS. So biofeedback, I have a patient of mine that has done really well with just biofeedback. So this is another modality. If you want to look at this thing, is called the M-Wave, and it's made by a company called HeartMath. And I think they have a home computer version as well. But those are modalities as well that you can do at home to try to help your autonomic nervous system.
I'm glad that you brought that up, because when you mentioned Avazia, there was something else I was thinking about that was similar but different, and by the biofeedback, the HeartMath was exactly what I was thinking about. I personally don't have that. I've only done biofeedback in a counselor's office, or actually for chronic pelvic pain. But I know that there are these different things that we can do at home. Like you, I also feel very strongly about trying to help people do what they can to help themselves at home. To not be so dependent upon going to the provider, or these different things that if you can invest in a certain couple things that help you at home, we can go so far. And it's also a complement to the other therapies that we do in our provider's office or with our healthcare team, which is so critical. But that can be, honestly, I'm sure other people agree, the hardest part too, is holding our own self accountable to do the work at home. I know so many of us struggle with that too. So
I'm happy to introduce these concepts. I would just encourage people to try something new, different, just because you never know which one will be the right one for you, because it doesn't all work the same. I've just seen people not respond to Reiki, respond amazing to acupuncture. Another person does nothing for them. Like, I don't know sometimes what is it that person's body needs or responds to. That's why I loved meeting Gina Sager, because she has a whole new potentially therapeutic option for people in the form of energy medicine.
And the last thing I will say is just something so simple, is that in line with the tests and the different things that you can offer at your office, that something simple as a drug metabolism test to make sure that you understand how the medications you are taking are appropriate for your body can be something that also is a huge trigger for us. I know it has made a huge difference in my life and other people's life, and that is something that you also offer at your office as well. And I know Dr. Pasinki offers it, and I think it's kind of become more customary too, but it still is something that not a lot of people recognize how integral and important it can really be. And there are so many of us, and I believe there's actually literature now that talks about how we as a community tend to have these different drug metabolism or drug mutation issues in terms of how we metabolize traditional medications, specifically SSRIs, pen medication, stimulants. So that's just another thing that I want to throw out there, is it's not necessarily integrative or complementary, but I guess it's part of the additional kind of testing that we can do to try to figure out what's going on that can also help us narrow down the things that do work, and also eliminate the things that could be triggering us. It could be just something simple like, your body doesn't metabolize the SSNRI that you've been on for a while. I just something so simple sometimes can go a long way. To helping find the path that works the best and making it shorter so that it's not such a long duration, but it does take time.
Yeah.
Anything else?
No, I'm happy to offer whatever.
Well, thank you for your time. I want to make sure that we get off the time. It's a time. Everybody's saying thank you. Thank you, Dr. Rao. It's always wonderful to talk to you and have you spend time with us. Thank you for devoting your time to us and volunteering it and giving us updates on different things that have worked in your practice and that you've learned about. I will make sure that I share the information with Danielle of how people can get a hold of you, as well as the links to the previous recordings and webinars that we've done before for anybody that is interested with Dr. Rao or Gina Sager, or the different ones that people might be interested in from previous retreats and stuff that I've done.
Okay, and I want to thank both of you for a very informative and interesting evening, and all that great information that I'm sure will be helpful to a number of people. So thank you again, and I appreciate it.
Thanks. Have a good night.
Thank you, everybody. Have a good night.
Good night.